Do you know the signs of a fatty liver disease? If not, you're not alone. Many people don't. Fatty liver disease, as the name suggests, is a condition where excess fat builds up in your liver. Now, a little bit of fat in the liver is normal, but when it makes up more than 5 to 10% of your liver's weight, it's called fatty liver disease. This disease is alarmingly common, affecting about 1 in 4 individuals worldwide. It's stealthy, often showing no symptoms until it's quite advanced. That's why recognizing the signs early on is crucial. Early diagnosis can lead to more effective treatment and prevent serious complications, like liver cirrhosis or even liver cancer. So it's essential to keep an eye out for any warning signs. In this video, we will walk you through 10 signs that could indicate you have a fatty liver disease. Stay tuned to learn more about this common yet often overlooked health condition. The first sign of a fatty liver disease can often be abdominal pain. Now, when we say pain, it's not always a sharp stabbing sensation. It could be a dull, constant ache or even a sense of discomfort, primarily located in the upper right area of your abdomen. This is because your liver is situated on the right side of your body, just beneath your rib cage. Some people might feel it as a persistent heaviness or bloating, while others might experience bouts of nausea. The intensity and frequency of this pain can vary widely from person to person, reflecting the extent of liver damage. Remember, our bodies have a unique way of telling us when something's not right. So, if you notice a constant discomfort or an unusual pain in your abdomen that doesn't seem to go away, it could be your body signaling a problem with your liver. Persistent abdominal pain should never be ignored and always be discussed with your healthcare provider. Another sign that could indicate a fatty liver is consistent fatigue. Fatigue, in a nutshell, is a lingering, overwhelming sense of tiredness or exhaustion. It's more than just feeling drowsy or sleepy. It's about being in a state of constant weariness that doesn't improve with rest. Imagine a day where you've had a full night's sleep, but you still find it hard to get out of bed. You're dragging yourself through the day, struggling to focus, and the smallest tasks feel like running a marathon. That's what fatigue feels like. It's debilitating, it's draining, and it can severely impact your productivity, mood, and overall quality of life. Now, we all have those days where we're feeling a bit off, but if you're experiencing this kind of exhaustion regularly, it could be a cause for concern. Fatigue can be a symptom of many health conditions, including fatty liver disease. If you're feeling unusually tired all the time, it might be more than just lack of sleep. It could be a sign of a fatty liver. Unexplained weight loss can be another sign of a fatty liver. Now let's dive deep into this. We all know that a sudden drop in those pounds might seem like a dream come true for some, but hold on. If you're shedding weight without any significant changes to your diet or exercise routine, it's not a cause for celebration. Instead, it could indicate an underlying health issue. And yes, one of these health issues could be fatty liver disease. A fatty liver struggles to function properly, and this can cause your body to burn fat and muscle tissue quicker than it should. This rapid breakdown of body tissue might cause you to lose weight unexpectedly. So, if you're noticing a change in your weight that you can't explain, it's time to listen to your body. Remember, unexplained weight loss isn't something to ignore. If you're losing weight without trying, it's important to seek medical advice. Don't hesitate. It's your health we're talking about here. The next 3 signs, jaundice, swelling, and itchy skin, are often associated with liver diseases, including a fatty liver. If you're noticing these symptoms, it's crucial to understand what they might mean. Let's start with jaundice. This condition is characterized by a yellowing of the skin and the whites of the eyes. But what's the connection to the liver? Well, jaundice occurs when there's too much bilirubin, a yellow-colored waste material, in the blood. The liver's job is to filter out waste like bilirubin. If the liver is fatty and not functioning properly, this filtering process can be disrupted, leading to jaundice. Next is swelling. This can occur in the legs, ankles, and feet, and is often due to fluid buildup, a condition known as edema. When the liver isn't working well, it struggles to produce enough proteins to hold fluid in the blood vessels. As a result, fluid leaks out and accumulates in the tissues, causing swelling. Lastly, let's talk about itchy skin. It can be a nuisance, right? But did you know it can also be a sign of a liver problem? The itchiness is often a result of bile, a digestive fluid produced by the liver, building up in the skin. When the liver is fatty, it may not be able to properly process bile, leading to this buildup. So what do these 3 signs tell us? Jaundice, swelling, and itchy skin are all signs your liver might be struggling. They're not just minor annoyances, they're signals from your body, telling you something's not right. Remember, the liver is a vital organ. It's responsible for filtering out toxins and waste from your blood, among many other functions. If it's not working properly, your whole body can suffer. These signs are often visible and can be easily noticed. Don't ignore them. Paying attention to these signs and seeking medical advice can help you spot a potential liver problem early and get the treatment you need. Remember, it's always better to be safe than sorry. The last 4 signs, dark urine, pale stool, loss of appetite, and confusion, can also indicate a fatty liver. Starting with dark urine, it's exactly what it sounds like. Your urine may take on a darker amber color. Now this could be due to dehydration, but it can also be a sign that your liver isn't breaking down toxins as it should. When your liver is struggling, bilirubin, a waste product, can build up and lead to this color change. Next, let's talk about pale stool. Normally your stool should be a medium to dark brown color. If you notice your stool becoming lighter, almost clay-colored, it could be a sign your liver isn't producing enough bile, or the bile isn't reaching your intestines. Bile is what gives stool its color, and when there's a lack of it, the stool can appear pale. Moving on to a loss of appetite. This can be quite subtle, and you might not even realize it's happening. You may find yourself eating less than usual or not feeling hungry at all. This can lead to weight loss, which we discussed earlier. Often this loss of appetite is due to your liver not producing enough bile, which helps break down fats and aids digestion. Finally, we come to confusion. This can be a more serious sign of fatty liver disease, particularly if it's accompanied by other symptoms. When the liver isn't functioning properly, toxins can build up in the blood and reach the brain. This can lead to a condition known as hepatic encephalopathy, which can cause confusion, poor concentration, and even changes in personality or behavior. It's important to remember that these symptoms can also be related to other health conditions, so it's crucial to seek medical advice if you're experiencing any of them. A healthcare professional can provide a proper diagnosis and guide you through the appropriate treatment plan. All these signs together or individually could be a warning bell for a fatty liver. So, these are the 10 signs that could indicate you have a fatty liver disease. Let's do a quick recap. 1. Abdominal pain. This is not your typical stomach ache. It's a persistent discomfort in the upper right part of your abdomen, just below the rib cage. 2. Fatigue. We're not talking about the kind of tiredness you feel after a long day, but rather a constant sense of weariness that doesn't go away, even after a good night's sleep. 3. Unexplained weight loss. If you're losing weight without trying and it's coupled with other symptoms, it could be a sign of a fatty liver. 4. Jaundice. This is when your skin and the whites of your eyes turn yellow, a clear indication that something is not right with your liver. 5. Swelling. This could be in your legs, ankles, or abdomen, and is caused by a buildup of fluid. 6. Itchy skin. This is not just a minor itch but a persistent itchiness that doesn't go away. 7. Dark urine. If your urine is consistently dark, even when you're drinking plenty of water, it's a sign that your liver may not be functioning properly. 8. Pale stool. This is often overlooked, but a significant change in stool color could be a sign of a liver problem. 9. Loss of appetite. If you're regularly not feeling hungry, it's something to take note of. And finally, 10. Confusion. This is a more severe symptom indicating that toxins are building up in the brain because the liver is not able to properly filter them out. These signs are not to be taken lightly. If you notice any of these symptoms, it's crucial to seek medical advice as soon as possible. Fatty liver disease is a serious condition, but with early detection, it can be effectively managed and treated. Remember, early detection is key to effectively managing and treating fatty liver disease. Don't ignore these signs, your health is in your hands.